Governor, you just heard, and we want to talk, before we get to politics, to this whole controversy about Ebola and the quarantine. You just heard Dr. Fauci, New York City's health commissioner, Dr. Mary Bassett, says reportedly was furious that she was not informed before the quarantine was imposed. Do you no longer trust the CDC and doctors and scientists?
Well, no, that's pretty general statement, Chris. Of course we do. But the fact of the matter is that the CDC protocols, as Dr. Fauci admitted himself, have been a moving target. And imagine that you're the person in charge of the public health of the people of a large, densely populated state, in fact, the most densely populated state in the Union, and these protocols continue to move and change. It was my conclusion that we needed to do this to protect the public health of the people of New Jersey. Governor Cuomo agreed, and now Mayor Emanuel agrees, and I think the CDC eventually will come around to our point of view on this.
And what about Dr. Fauci, who says it's just not good science to quarantine people when they're not symptomatic because they can't spread the disease in those situations?
Well, listen, I have great respect for Dr. Fauci, but what he's counting on is a voluntary system with folks who may or may not comply. We had this situation in New Jersey, Chris, as you know, with the NBC News crew that said that they were going to self-quarantine, and then 2 days later, they were out picking up takeout food in Princeton and walking around the streets of Princeton. I mean, the fact of the matter is that I don't believe, when you're dealing with something as serious as this, that we can count on a voluntary system. This is government's job. If anything else, the government's job is to protect the safety and health of our citizens. And so we've taken this action, and I absolutely have no second thoughts about it.
Well, let me just ask you about one other aspect of it. Dr. Fauci talked about the unintended consequence. Everyone agrees that the only way you're going to stop this crisis is to end Ebola in West Africa. And the concern is that the medical workers, the doctors, the nurses that are willing to take their chances and go over there, when they hear now that they're going to have to undergo a mandatory 3-week quarantine, when they come back, may decide not to go in the first place. And in fact, the first nurse who has gone through the quarantine in New Jersey says that she feels she was badly treated. So are you concerned that you're going to disincentivize people from going over there to help stop the outbreak?
No, I'm really not, Chris, because I believe that folks who want to take that step and are willing to volunteer also understand that it's in their interest and in the public health interest to have a 21-day period thereafter if they've been directly exposed to people with the virus. And as we saw with what happened with some of the healthcare workers in Texas, with the CDC shifting protocols, we had people who were infected from that type of contact. And we just can't have that in the New York, New Jersey area. And that's why Governor Cuomo and I agree on this. And now you see that they agree in Chicago as well. I think this is a policy that will become a national policy sooner rather than later.